Diabetic, foot infection. As we can tell, his great toe was resected several months back due to ulceration and microvascular disease, leading to bone infection. It's called a partial first ray resection. Uh, Typically with such procedures, it's best to do an Achilles lengthening or a tenotomy to remove the pressure off the forefoot, which is the ball of the foot. And there's also tendon imbalance in regards to contractures of the toes, as we can clearly see, which is common and typical. In this situation, I haven't seen this patient in at least 2+ months. He presents today with a red swollen toe, and the nail was kind of loose at the tip. We can see the discoloration and the size, the girth, in comparison to its neighbors. So now when we look at the toe, I clipped a little bit of that toenail, and as we see, there's an ulceration. As we see, there is an ulceration. But what's interesting is when I move the toe up and down, there is a hole, as you guys can clearly see, underneath, and that probes the bone. So it is of concern, as you can see, the darkness, discoloration, which is the dark red along the pinkish area, that's the hole, as we can see as we move the flesh around. So if I move the toe up and down, we can see the indentation. That could have been possibly because the nail was too long, digging into the flesh, creating an opening, an ulceration, and immediately they get infected fairly quick. But now, since this is all red and it probes the bone, it requires care. The involvement would be hospitalization and placement on antibiotics and removal, hopefully just the tip rather than the entire toe, to remove that contracture. And at the same token, monitor the other lesser toes. If there is no fusion to the toe, we might have to go further up. I also like anticoagulants immediately upon closing this, which would be delayed closure. So initially you disarticulate, and then a couple of days later go back and close it, called delayed closure, and then placement on oral anticoagulants. Which is great for recovery for the patients in the diabetic population. So anyway, so we've got a toe that's infected. We've got a hole as we move it up and down. We can see that. Now I think it's a better visualization in comparison to before. We can see the hole, we can see the bone moving underneath the flesh. So that needs care. Thank you.